Hello. Dr. Meredith Hayes here. Today, we are going to tackle a question that is on the minds of millions of men over 50, but one that is rarely discussed openly. It's a topic surrounded by decades of myth, shame, and conflicting information. And that question is masturbating every day good or bad for my prostate? On one hand, you hear that frequent ejaculation is protective against prostate cancer. On the other hand, you might worry, am I overdoing it? Am I depleting my vital energy? Could this somehow be harming me in the long run? It's a confusing and deeply personal question. As a urologist, I believe it is my duty to replace confusion with clarity, and to replace shame with science. So, in this video, we are going to do a deep dive into the latest, most robust scientific evidence. We will separate fact from fiction. We will look at what the studies really say about ejaculation frequency, prostate cancer risk, BPH, and overall sexual health in men over 50. This is a crucial conversation for your long-term health and peace of mind. To properly answer this question, we can't just give a simple yes or no. We have to break it down into 3 key areas of concern that men have. 1. Prostate cancer risk. This is the big one. Does masturbating more often increase or decrease the risk of developing the most common cancer in men? 2. Benign prostatic hyperplasia, BPH. What about the non-cancerous enlargement of the prostate that causes all those frustrating urinary symptoms? Does daily masturbation make it better or worse? 3. Testosterone and sexual function. Does daily ejaculation deplete your testosterone? Does it affect your ability to get an erection with a partner? Or does it keep the machinery well-oiled? For centuries, masturbation was viewed as a moral failing, a vice that would lead to all sorts of physical and mental ailments. This outdated, unscientific thinking still casts a long shadow and creates a lot of unnecessary anxiety. My goal today is to shine the bright light of modern science onto this topic and dispel those shadows for good. We will be looking at major epidemiological studies that follow tens of thousands of men over many years, to understand the real-world impact of ejaculation frequency. This isn't about theory, it's about data. Part 1. The Ejaculation Prostate Cancer Link, the Harvard Study. This is the most important part of our discussion. The single best piece of evidence we have comes from a massive, long-term study conducted by researchers at Harvard University. It's called the Health Professionals Follow-Up Study. This study followed nearly 32,000 men for almost 2 decades, from 1992 to 2010. The men were asked to report their average monthly ejaculation frequency at different points in their lives. The researchers then tracked who went on to develop prostate cancer. The findings were consistent and clear. Men who ejaculated more frequently had a significantly lower risk of developing prostate cancer. Let's look at the numbers, because they are powerful. Men who reported ejaculating 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. This wasn't a small, insignificant finding. A 33% risk reduction is massive. This protective effect was seen across all age groups in the study. The leading hypothesis, the prostate stagnation theory. Why would this be the case? The leading theory is what I call the prostate stagnation hypothesis. The prostate is a gland that produces fluid. If this fluid is not regularly flushed out, it can stagnate. This stagnation can lead to a buildup of old cells and potential carcinogens, cancer-causing substances. Regular ejaculation acts like a cleansing mechanism. It flushes out the prostatic ducts, removing these potentially harmful substances before they can cause trouble. It also reduces inflammation within the gland. So, from the perspective of prostate cancer risk, the best available evidence does not just say that daily masturbation is not bad, it strongly suggests that it is actively protective. The idea that you are overdoing it is, from a cancer prevention standpoint, scientifically unfounded. Part 2. What about BPH and urinary symptoms? Okay, so it's good for cancer risk. But what about BPH, the prostate enlargement that causes you to get up all night to urinate? The logic, the mechanism of BPH is primarily hormonal, driven by a derivative of testosterone called dihydrotestosterone, DHT, as well as age-related inflammation. The question is, does ejaculation frequency affect this process? The evidence, the research here is less definitive than the cancer research, but it is still encouraging. Some studies have found a link between less frequent ejaculation and a higher risk of BPH and lower urinary tract symptoms, LUTs. A 2016 study published in the journal Urology found that men who ejaculated more frequently had a lower risk of developing BPH that required surgical treatment. The hypothesis, the reasoning is similar to the cancer hypothesis. Regular flushing of the prostate may help to reduce inflammation, which is a key driver of BPH. While ejaculation doesn't directly shrink the prostate, it may help to create a healthier, less inflamed environment within the gland, potentially slowing the progression of BPH symptoms. The verdict: there is no evidence to suggest that daily masturbation makes BPH worse. The available data, while not as strong as the cancer data, suggests it may be neutral or even slightly beneficial. It certainly does not appear to be harmful. Part 3: The testosterone and sexual function myth. This is where a lot of the myths come from. The idea of semen retention, or that you are depleting your essence by ejaculating. The myth: ejaculating daily will crash your testosterone levels, leaving you weak and unable to perform with a partner. The scientific reality: this is biologically incorrect. Let's break it down. 1. Testosterone production. Testosterone is produced in the testicles, primarily, and regulated by a feedback loop with your brain, the pituitary gland and hypothalamus. It is not stored in your semen. Ejaculation has only a very minor, temporary effect on testosterone levels. Studies have shown that after ejaculation, testosterone levels might dip very slightly for a short period before returning to baseline within hours. There is absolutely no evidence that regular ejaculation lowers your overall, long-term testosterone production. In fact, some studies show a slight increase in testosterone with sexual arousal. 2. Semen production. Your body is a semen-producing factory. It is constantly making it. The components, sperm from the testicles, fluid from the seminal vesicles and prostate, are always in production. When you ejaculate, you are simply clearing out the inventory. Your body immediately starts making more. You cannot run out. 3. The refractory period. After an orgasm, men experience a refractory period where they cannot immediately get another erection. This is a normal neurological and physiological response, driven by the hormone prolactin. This period can get longer with age. However, daily masturbation does not permanently lengthen this period. It is a short-term recovery phase. The use it or lose it principle. From a functional standpoint, regular masturbation is like exercise for your sexual response system. It keeps the blood vessels pliable, the nerves firing, and the pelvic muscles engaged. Long periods without any erections or ejaculations can lead to penile tissue atrophy and a weakening of the neural pathways. Regular, safe masturbation keeps the entire system tuned up and ready to go when you are with a partner. Part 4: The important caveat, the how matters. So, the evidence is clear. From a physiological standpoint, daily ejaculation is not only safe but likely beneficial for prostate health and sexual function. But there is a huge caveat here. The psychological and physical context matters. 1. The problem with pornography. If your daily masturbation is dependent on hardcore pornography, you can run into serious problems. You can train your brain to require increasingly extreme visual stimulation to get aroused. This can lead to erectile dysfunction when you are with a real-life partner, because reality can't compete with the fantasy on the screen. This is called porn-induced ED, and it is a real and growing problem. 2. The problem with aggressive technique. If you use a very tight, aggressive death grip when you masturbate, you can desensitize your penis. This can make it difficult to achieve orgasm during intercourse, which provides a different, less intense sensation. The healthy approach: masturbate to your own thoughts and imagination. This keeps your brain's arousal circuits healthy and grounded in reality. Use a looser grip and lubricant. Try to mimic the sensation of intercourse. This keeps your penis sensitive to different kinds of stimulation. Focus on the entire experience of pleasure, not just a race to the finish line. So, the act of daily ejaculation is healthy. The way you do it determines whether it supports or harms your overall sexual health with a partner. So, let's answer the question once and for all. Is daily masturbation after 50 good or bad for the prostate? The overwhelming weight of scientific evidence points to a clear conclusion: it is good. For prostate cancer, the strongest evidence we have suggests that frequent ejaculation, 21 plus times a month, is significantly protective, potentially lowering your risk by a third. For BPH, there is no evidence of harm, and some data suggests it may be beneficial in reducing inflammation. For testosterone and function, it does not deplete your testosterone. It is a healthy way to maintain the function of your nerves, muscles, and blood vessels, the use it or lose it principle. The myths and shame surrounding masturbation are relics of a pre-scientific era. In the 21st century, we must view it for what it is: a normal, healthy, and physiologically beneficial activity. It is a form of self-care and a tool for long-term health maintenance. So, gentlemen, I want you to let go of the guilt, the shame, and the confusion. If you enjoy daily masturbation, and you are doing it in a healthy, mindful way that does not rely on pornography or aggressive techniques, then you can rest assured. You are not harming yourself. In fact, you are actively participating in a habit that is one of the most powerful, evidence-based strategies we know of for protecting your prostate and maintaining your sexual vitality for decades to come. If this video has helped to clear up your confusion and given you peace of mind, please do me a personal favor and hit that like button. It's time to bring this topic out of the shadows. Subscribe to my channel for more honest, science-backed answers to the health questions you are actually asking. And ring that notification bell. And in the comments, I want to create a space of liberation from old myths. Simply write, science over shame. Let's declare together that we are choosing to be guided by facts, not by fear or outdated morality. Your comment can help another man feel less alone. Thank you for your trust in this important conversation. Disclaimer: the information in this video is for educational purposes and is based on published scientific research. It is not a substitute for personal medical advice. Always consult with your healthcare provider for any personal health concerns. Thank you.